The fourth factor influence distribution of drug is central nervous system and cerebrospinal fluid. Central nervous system and cerebrospinal fluid. Central nervous system and cerebrospinal fluid. The distribution of drug into central nervous system from the blood is unique. There is a blood-brain barrier. We call it BBB. There are two characteristics. One, the brain capital endothelial cells have continuous tight junction. Drug penetry into the brain depends on transcellular rather than paracellular transport. 2. Out of brain capital endothelial cell, there is layer of pericapital glia cell. We call it astrocyte. This is transcellular transport, and this is paracellular transport. Here is endothelial cell, and this is tight junction. And out of endothelial cell, there is layer of astrocyte. Here is blood, here is brain, and here is blood-brain barrier. There is a layer of endothelial cell, and there are continuous tight junction. Out of endothelial cell, there is a layer of astrocyte. So, the drug is now easier to pass through the brain barrier from blood to the brain. Blood-brain barrier, BBB. Here is a vessel. Here is red blood cell, and here is endothelial cell, and here is tight junction, and here is layer of astrocyte. When drug bound to the plasma protein, it becomes a large molecule. It's now easier to pass through the BBB to the brain. Only unbound drug could pass through BBB to reach the brain. For example, sulfonamides protein binding are virus from 20% to 90%. Most of drugs have high percentage to bind to the plasma protein. Only SD, sulfonylurea, protein binding is only 25%. So, only SD could pass to BBB to prevent and treat meningitis. Blood-brain barrier for its spectral structure, the lipid solubility of non-ionized and unbound species of drug is an important determinant of its uptake by the brain. The more lipophilic a drug is, the more likely it is to cross the blood-brain barrier. This situation often is used in the drug designed to alter drug distribution to the brain. For example, antihistamine agent. Loratadine is a second-generation antihistamine. It could achieve far lower brain concentration than diphenhydramine and are non-sedating. Blood-brain barrier also have membrane transporters. Present in brain capital endothelial cell, we call it efflux carrier. 1. P-glycoprotein. 2. Organic anion transporting polypeptide are two notable of this transporter. They could remove diverse drugs from the cell. The effect of this exporter are to dramatically limit access of the drug to the tissue, expressing the efflux transporter. Here is a efflux carrier. Expression of efflux transporters account for the relatively restricted pharmacological access to the brain and other tissue, such as testes, where drug concentration may be below those necessary to achieve a desired effect, despite adequate blood flow. Is a protective action. Meningeal and encephalic inflammation increase local permeability. Multiple choice. Which drug is easier to pass to BBB? A. Propranolol, high lipid solubility. B. Atenolol, low lipid solubility. C. Gentamicin, water solubility. D. Valvoline, protein binding is 99%. E. Free bilirubin. The answer is A and E, because only lipid solubility drug, unbound drug, and the non-ionized drug and the small molecule is easier to pass through BBB.